Coming to Hope gives a patient the ability to be seen by fellowship-trained radiologists, fellowship-trained surgeons.
I think it's really wonderful for a lot of our patients to be able to see a lot of us under the same roof on the same day.
If one of our shared patients happens to be in her clinic, I can walk down, and it doesn't have to be a big formal visit, but just to answer quick questions that they might have.
That's really unique and honestly speeds up the care that they get.
The more information and the more options you're able to give a patient, the better they're typically going to do and the better they're going to feel when they walk out of here.
So immediate reconstruction has kind of become the standard of care, across America. And the benefit of having reconstruction at the time of mastectomy, it's one surgery, one recovery. But the most important reason to me is, a woman's going to wake up from surgery feeling whole, feeling like herself afterwards. I think that's really important. Western North Carolina is unique in that there are not a plethora of reconstructive plastic surgeons in the area.
If I didn't have access to plastic surgery, then the patient would have to essentially go flat for an extended period of time so they could get any therapies they needed after surgery, radiation or chemotherapy. They would then be referred to a plastic surgeon who would then likely place tissue expanders and then eventually move on to final reconstruction. So having the ability to coordinate those surgeries into just one really takes the patient's journey from the surgical side of things from a 6 months to a year-long process down to a one-day.
My passion as a woman being able to offer immediate reconstruction or breast reconstruction to the women I take care of is so that they can move past their cancer diagnosis and kind of feel whole as soon as they can after surgery. Some women, have slightly larger breasts than they came in with and they're excited about that. The women who we have a lumpectomy with a breast reduction, most of them have wanted smaller breasts for the majority of their adult life. So they are happy with having less back, neck, and shoulder pain.
I think the advantage that Hope provides is not just fellowship-trained top-level surgeons, but wonderful nurses, wonderful nurse navigators, people that really care about the patient. Every nurse here knows every patient that comes through, not just for surgery, but for the entirety of their care. And so I think you're hard-pressed to find a place that sees the patient like a member of the family like we do here.